Welcome back to CLE Weekend. So I'm excited this morning to be sitting here with Kelly Price from Reset Medical and Wellness Center. And the reason why is because we are talking about mental health and options for healing that maybe you didn't know about. So let's go ahead and tell us first, what is Reset Medical and Wellness Center?
So Reset Medical and Wellness Center is focused mostly on treatments that help with mental health, depression, anxiety, menopause, long COVID. We do some different things such as trigger point therapy to release myofascial pain and some IV treatments to kind of keep the longevity of your health going. But our main thing is our neurosympathetic reset.
Okay, you're one of the founders.
Yes.
So you have got to tell me, what was the inspiration? How did this come about? I feel like I heard a story where you were, looking at a flight board or something like that? Am I right?
Yeah.
Okay.
Yeah. So actually, I was involved in a couple of documentaries related to social action awareness campaigns. And we were following a doctor that was treating people for PTSD in the military. And when I found out about it, I'm like, does this work for firemen? I've really got to get my son in. And immediately got on the phone with the doctor, scheduled the treatment, and before I even got there, I walked in saying, I want to know how I can open a center like this in Cleveland. I know so many people that need help related to all of the modalities we treat.
Yeah, the mental health awareness too, it is so important, and I think sometimes people get stuck and they feel like, okay, this might be the end of the road in terms of what else can I do?
Yeah, and the reset, when we look at resetting your nervous system, it's very much like a computer. The first thing the IT team tells you when your computer isn't working is, have you restarted it? Yeah. And so by resetting your sympathetic nervous system, it allows you to start processing again. So then when you go to talk therapy or you do meditation or you do different things, all of a sudden those type of things start working a little bit better.
What's the biggest goal for you with having opened this up?
Our ultimate goal is to give back the proceeds to help other people. In the long run, we partner with a nonprofit called Erase PTSD that helps people that can't afford to get the treatment, but our long-term goal is just to provide hope and healing to as many people as possible.
I think you're doing that. Even just now, I feel you're providing me with that, just knowing to be able to tell more people about the option that is out there, because I do feel there are so many people that feel like they're at the end of the road and that there is this option right here in Strongsville.
We don't realize that PTSD and mental health is actually an injury to your sympathetic nervous system, and it can be healed through the neurosympathetic reset treatment.
Yeah, so I want to talk more about that, but you said you can't do it all, right? You need a doctor.
Right, yeah.
And that's who I want to go talk to. I'm going to go in one of your treatment rooms and talk to Dr. Lowers.
Yeah, he's much better at talking about this than me.
Listen, you're great. I love chatting with you, but yeah, I do want to talk to him a little bit more about what you guys offer.
That would probably be
Let's
good.
go find him. So I rolled on in here. I'm in one of the treatment rooms, and I just want to make sure if you are at home watching this, you know that we've got Emmanuel here, and we are giving an idea of exactly how this procedure would go. Normally, Dr. Lowers, you would have on a mask, but so we can see your mouth moving as you're talking,
Right.
we ditched the mask for right now. So let's first talk about the treatment that you do in this room and how it's effective.
What we're doing today is a neurosympathetic reset, and we do it under ultrasound. That way we can do it very safely and effectively. With traditional therapies like talk therapy and medications, often effective, but this uses a very different approach to treating those conditions. So the way it works is many patients that have been through traumatic conditions have an elevated fight or flight response. That's the part of our nervous system that responds to stressful conditions. Like if we're in the woods and we hear growling, what happens? Heart rate gets going, your adrenaline gets pumping. In that scenario, it's healthy, but if that continues, it can be very unhealthy. And it's what contributes to anxiety disorders and PTSD. And our procedure blocks that part of our nervous system temporarily. And even a temporary block of that part of our nervous system allows months to years of benefit from those triggers. The treatment itself's been around for 100 years to manage certain types of pain, but only recently it's been utilized in this way to help mental health.
So show me how it works.
Sure. So right now I'm taking a look at the patient's neck with the ultrasound. These are live images of his neck, and I'm looking at the anatomy. I'm looking at the blood vessels here, the carotid and the jugular vein. I'm looking at the bone, and just between those structures is the nerve, the stellate ganglion, or part of the sympathetic chain. It's our fight or flight system, and that's the nerve that I'm targeting with this procedure. I'm going to use this picture in real time to guide that injection right down to that nerve. So that way it can be done very safely, effectively, and it's a very well-tolerated procedure.
Wow. So about how long does this process take?
So the procedure is pretty quick. It's really only about a 15 or 20-minute procedure. The patient would recover for about a half hour after and be able to go home after that.
How often would we have to come in?
So that's the great news. The vast majority of patients that we're seeing are getting benefit that is lasting months to years.
Wow.
Many of them don't need to come back for a second treatment. They can utilize this to address their triggers and then be more effective with other conventional treatments like talk therapy.
That's amazing to hear. I would not honestly have expected that. And I think the big thing is too, you do not need a doctor's referral.
That's correct. A lot of patients don't even realize that they are suffering with anxiety disorders, that they have PTSD. So if they go online, they take our free assessment, they can see if they qualify. Someone from our office will contact them.
Dr. Lowers, thank you so much. Patient, thank you so much. I appreciate it. You did good for us. And I love just being able to see how this stuff works, because sometimes you don't get that. Again, tell us where that website is so we can get more information.
TheResetCenter.com.
Wonderful. Thank you so much. Reset Medical and Wellness Center right here in Strongsville. We'll be right back on CLE Weekend.